And I have put in the chat here both Lifelong's website as well as the email for our high cap Medicare program coordinator, Elaine Poley. So I just want to thank everybody for joining us today. My name's Liza Berger, and I'm the executive director at Lifelong, but in a past life, I served as the high cap coordinator here at Lifelong, and I've kept my certification up for this program, and I really believe in the great help that the program provides. High cap or health insurance information counseling and assistance program provides free, unbiased counseling really for anyone who's approaching eligibility for Medicare or they already have Medicare. We'll talk a little bit about those services later. But I just want to say that it's really easy to get confused about this, and we are here to help you with your individual situation. So I also invite you to pick up one of Lifelong's catalogs or check out our website, which I put in the chat. We have a lot of different offerings that may be a lot more fun than Medicare. We also do free tax preparation. We offer semester-based classes, health and wellness, creative arts activities, social groups, just a lot of different things. So check us out if you aren't familiar with us already. I did want to say too that there will be an opportunity for people to ask questions. I would suggest that you either throw your question in the group chat if it's something pressing, or wait until this is done because your question may be answered along the way. So today's goal, what we're looking at really is just giving an overview of eligibility for Medicare, when to sign up. We're also going to be talking about how Medicare works with other insurances, including active employer coverage or retiree coverage. Can I ask, let's see, I don't know if I can see everybody, but I'm curious how many of you are already enrolled in some part of Medicare. So maybe at this point, people could take themselves off mute and let me know who's already enrolled in Medicare. Anyone? Okay, so maybe you're all new to this process. It's good way to get a gauge who my audience is today. So Medicare is a federal program of the Social Security Administration. So while it's administered by CMS, the Center for Medicare and Medicaid Services, you actually enroll through Social Security. CMS determines who's entitled to get Medicare. The enrollment in Part A and B goes through Social Security, and that's also where you would go if you have a change of address or you need to replace a lost card. Most folks think of signing up for Medicare once they hit age 65. But there are other individuals who may be eligible. So if someone has a disability and they're receiving Social Security disability for a couple of years, then they'll automatically be enrolled in Medicare after that 2-year period. And also individuals who have end-stage renal disease or ALS would also be eligible for signing up for Medicare before age 65. So I'm going to go a little bit into the two parts, parts A and B of Medicare, which are the core. Part A is your hospital insurance. And typically with Part A, most people find that Part A is premium free. And again, that's if you have paid into FICA taxes for at least 10 years in the United States, then your Part A or hospital insurance will be free through Medicare. Part B or your medical insurance, you can see that the monthly premium that we have right there is 202.90. That goes up every year. And typically that is automatically taken from your Social Security check if you're collecting Social Security. If you're not yet collecting Social Security, they usually arrange for that bill to be for the quarter you would receive for the quarter. That 202.90 is what most people pay. And by most people, I mean people who have an annual income that doesn't exceed $103,000 for a single person, and $206,000 for a married couple. And when they make that determination, that's based on your modified adjusted gross income from 2 years prior. So in this case, that would be 2024. If your income is higher than that, then your Part B monthly premium will increase, as well as your Part D drug plan. So we'll talk about that in a little bit more. So unfortunately, you can't expect that Parts A and B are going to cover all of your costs. There are different copays and deductibles and other out-of-pocket costs that you likely will be responsible for, and we'll go into some more detail about that. So let's break it down a little bit. Medicare Part A, or your hospital insurance, that helps cover your stay if you are admitted into a hospital. Again, it's not if you're sitting in the ER and have not been formally admitted, but if you have been admitted into the hospital, Part A helps to cover that. It also helps pay for a skilled nursing facility or a nursing home and individuals who are receiving a skilled level of care. So a short-term rehab, if they're receiving physical or occupational or speech therapy, those would all be skilled needs or a skilled nursing need. That Medicare Part A would help pay for those things. As far as inpatient skilled nursing, I will say that there are typically Medicare requirements for original Medicare to cover that. You would have to be inpatient in the hospital for 3 days, at least 3 days before Medicare will kick in original Medicare to pay for your stay there. Medicare A also can help pay for home health care. You'd have to get a doctor's order saying that you're pretty much homebound to get that coverage. And it also can pay for individuals receiving hospice care. And again, I just want to say the hospital stay would only be for inpatient. You might be under observation status for more than 24 hours in some cases. So it's always good to ask about that. And the hospital has to tell you if you're inpatient before 36 hours have passed. So Medicare Part B, you can see the different things that Medicare Part B can help to pay for. These would be your doctor's visits. It can pay for another part of home health care or contribute to that. Some of your services like x-rays and labs. Sometimes Part B will also cover some medications if they're administered by an injection or a machine versus taken by mouth. So what don't they cover? Medicare A and B do not cover all the things that are listed here. Rather than reading it, I'll just have you take a look. I will say that dental and vision care often are offered through a Medicare Advantage plan. And this is one of the biggest reasons that some individuals go with a Medicare Advantage plan rather than sticking with original Medicare. So when do you enroll? One of the things that we're seeing, and as I mentioned, if you are receiving Social Security disability for 2 years, then you're automatically going to be enrolled in Medicare A and B. Many individuals are working longer than age 65. So we do see a lot of folks who delay their Medicare enrollment, especially Part B. If there's a charge, since there's a charge for Part B, as they're working longer and they might be covered under active employer insurance. So we'll have a little bit more on that later. I do want to note that if you're not already collecting Social Security when you turn 65, you are responsible for enrolling yourself in Medicare. It's not necessarily going to happen automatically. So when you enroll really depends on when you want your coverage to start. So what happens if you're not taking Social Security at age 65? Again, a lot of people are delaying. Um, if you are not collecting Social Security for at least 4 months before you're eligible for Medicare and you don't have active employer coverage from an employer that's considered a larger employer with over 20 employees, then you should go ahead and actively enroll in Medicare Parts A and B. Okay. If you miss that initial enrollment period and you don't have any other appropriate coverage, you could be subjected to a penalty. And there are only certain times in which you can enroll outside of that initial time frame. So you can see this here. What we typically encourage people to do is start thinking about their initial enrollment period as they're leading up to their 65th birthday. So again, this would be if someone does not have active employment coverage, not retiree coverage, but current active employment coverage, that would serve them as their primary insurance. So if you are approaching age 65 and you need to sign up for Medicare, you can start thinking about that. You can sign up 3 months before your 65th birthday month, and the coverage would start the first day of the month you turn 65. Okay. You can also sign up the month you turn 65 or during the 3 months after. Those are the 7 months that are included in the initial enrollment period, and your coverage would start the first of the following month. So a lot of people are just strategic about when they choose to sign up, and that's something also that we can help with. You can enroll right online, or you can do this in person in the Social Security office or by phone. And some people say that you have to wait to get an appointment by phone, but even if you call and want to do this by phone, the date that you call would be considered the date that you will be enrolling, even if the phone call is a little bit later. So what happens if you miss that 7 month period? And again, I mean, really what you want to be thinking about in advance is when you need that coverage, because if you, and even though you're allowed to enroll up to 3 months after your 65th birthday, you may not have any coverage set up at that time if you're enrolling at the later time, but you wouldn't be penalized. So if you miss that 7 month window, first of all, if you are eligible for that premium-free Part A, again, you've paid in for at least 10 years, you've worked for 10 years and paid FICA, there is no premium for your Part A. So you can enroll in that anytime after that initial enrollment period because there's no fee, okay? Part B, however, which is the part that most people have to pay for, there is a general enrollment period from January to March, and the coverage would start the first of the month after enrollment. So if you miss that initial enrollment period, you will have to wait to enroll during that general enrollment period unless you have a special period within which to enroll. If you wait and you miss that time frame, there is a penalty, and it goes up for each 12-month period. You could have had Part B, but you didn't sign up. Now, I talked a little bit about individuals who have active and employer health insurance, and many of those folks choose to defer their Part B enrollment if they're covered by either their own or their spouse's current active employer health insurance. And you can understand why you would do this because that can still be your primary health insurance, even if you're over 65, and you can avoid paying that Part B premium until that active insurance goes away. So this happens a lot. And again, this delaying of Part B enrollment only works if your employer coverage is with a company of over 20 employees. So if it's fewer than 20 employees, then Medicare is going to be your primary payer, and you would have to be enrolled in A and B. Um, so if you are in this scenario and you have insurance through your employer, you choose to retire or you lose that position and lose that coverage, you have an 8-month window after you lose that insurance, that active employer insurance, to sign up for Part B. So that's a special enrollment period. And what I'll say about that is, again, if you're somebody who has active employer insurance and you're starting to think about retirement and needing to sign up for Part B, you may begin that process 2 or 3 months before your retirement and just put in that you want the coverage to start and be set to go the first of the month after you retire. So you wouldn't be charged early for it, but it's good to do this early so you avoid any lapse in coverage. Again, if you don't enroll in that 8-month special enrollment period after your active employer coverage ends, there could be a delay in when you can sign up. And I will say, again, with current active employer health insurance, you can see the letters are in red and just emphasizing the importance, and that this is not the same as retiree health insurance or COBRA. It's only current active employer insurance. So it's always a good idea to speak with your employer if you're contemplating this change, to make sure that when you turn 65 that your employer insurance is still going to be your primary insurance. It's a big enough employer. Um, Again, I just want to say, if people have other questions, feel free to throw them in the chat and I can take a look at that as I go along. Otherwise, I'm going to keep plugging away. So, one of the things I wanted to just mention about the current active employer insurance is the time that you would not want to, you might want to join Part A if it's premium free, even if you have this active employer insurance, because you don't have to pay anything and it can give you secondary coverage to your employer insurance. So if you end up in the hospital and you have a bill, your employer might be primary, but what they don't pick up, Medicare Part A may pick up for you. So it could be beneficial. The only time you don't want to do that is if your employer insurance is a health savings account or an HSA. The reason for that is a health savings account is a tax advantaged savings account, so it's tied to a high deductible health insurance plan. And if you're contributing to an HSA, you can have no other health insurance besides that plan. So you cannot be enrolled in Medicare at the same time, or there will be tax ramifications. So if this is kind of detailed, but if this is a situation that applies to you, you certainly can reach out and we can talk about it more. But typically what we advise is that people would stop contributing to that HSA 6 months before they retire and start with Medicare. And that means that's because your Part A would go retroactive up to 6 months. So again, if you are somebody with an HSA with active employer insurance, reach out to us and I can send you some more details. So again, if you miss that 8-month period, that window for the special enrollment, you likely will have to wait for the general enrollment period. And the Part B would be effective the first of the following month after you enroll. I will mention that that case is different if you are someone who's has lower income, and we'll talk about that in a little bit. So I'm going to kind of break down the two different ways to get coverage under Medicare. One is just sticking with original Medicare, which, as we already mentioned, that would be Parts A and B. And you can do that with or without a supplemental plan. Sometimes retiree insurance complements original Medicare, so that's one way. Or you could go with a Medicare Advantage plan, which less commonly is called Part C. Um, and so that's a different way to get those benefits. And we're going to break both of these down. Both are ways to get coverage through Part A and Part B. What services that they cover and when you sign up is the same. So you do have to have Part B, whether or not you're sticking with original Medicare or a Med Advantage. So I'm going to go with door number one, which is original Medicare. This is again your Part A hospital insurance. Part B is your medical insurance. As I mentioned earlier, there are additional out-of-pocket costs. And that's the reason why some people, if they can afford it, choose to go with a supplemental or a Medigap plan to help pick up some of those out-of-pocket costs that result from being just on A and B. With original Medicare, there is no maximum out of pocket. So that means if you go this route and you elect not to get a supplement to pick up some or all of the 20% that Medicare doesn't cover, that could get pricey if you end up with unexpected healthcare costs. We've all seen somebody can go to the hospital and, easily end up with a $10,000 bill. So if Medicare A and B might pay 80% of that, but you're still going to be stuck paying 20% unless you have some other coverage that will help to pick that up. A benefit with original Medicare is that you can use it anywhere in the United States with providers that accept Medicare, which is most of them. I will say that this doesn't cover prescription medications, and we'll talk about that a little bit later. So right now for 2026, this is an example of the deductible for original Medicare for Part A. Again, this would be if you were an inpatient in the hospital, if you meet the need for acute hospital care. Medicare Part A is going to pay for all of it except for the inpatient deductible, which again, $1,736 is what it is this year. That's for the first 60 days. If you remain in the hospital beyond that, through 90 days, then the last 30 days you would be responsible for a co-insurance. And I don't have that figure right in front of me. Last year it was like $419 a day, so it's pretty pricey. If you're discharged from the hospital and readmitted within that 60-day benefit period, you're not responsible for the deductible because that's within your initial benefit period. But if you're readmitted after 60 days, you are responsible for the deductible again because that would be considered a new benefit period. Now, most people don't stay in the hospital that length of time, but I just wanted to give that information. As far as a skilled nursing facility, remember we talked a little bit about Medicare covering if you meet the need for skilled nursing or therapy and you've met the qualifying inpatient stay at the hospital. Medicare would pay in full for days 1 through 20 at the skilled nursing facility. And then for days 21 up to day 100, you would be responsible for a co-insurance. Again, it would be like over $200 a day for a skilled nursing facility. And I will say there is no deductible for nursing homes. So now we'll jump to Part B, which again is your medical insurance part of Medicare. Those are the costs shown there, your monthly premium. Again, if your income is not above that 109,000, I think it was, that's the standard monthly premium. And you would pay more if your income is higher than that. I want to mention one thing about that higher income. A lot of times we have people who are joining Medicare and they've just retired. So, again, when they come up with this figure as to whether you have to pay a higher premium, they're looking at your income from 2 years ago. So I would encourage people, if your income, usually when you retire, your income on retirement is not going to be the same as what you had 2 years ago when you were working full time. So if that's the case and you get a notice from Social Security that says, hey, you need to pay a higher premium, you may appeal that if there's a change in your income since that time. So don't hesitate to look at that. Okay, so again, with door number one, if you go this route, you'll typically have three cards. You'll have the red, white, and blue Medicare card. That's your parts A and B. If you have a supplemental plan through a Medigap, you would have a separate card for that coverage. And you would also typically have a Part D or prescription drug card. I'm going to talk about those supplemental plans a little bit. Medigaps are designed to work hand in hand with original Medicare Parts A and B. So, as I mentioned earlier, this helps with copays and coinsurances that I mentioned. Um, and one of the things that's really important to know about this is no matter which insurance company you purchase a Medigap from, the coverage will be the same. I'm going to show you a little bit about the variety and costs for this kind of thing. So I've had people call me and say, I chose this plan because Joe Namath was in the advertisement for this, but it's really important to kind of look at and compare the different Medigaps so that you can be assured that you're going to get the same coverage, but it makes sense to look at the pricing. How much is covered in a Medigap really depends on which level of the plan that you buy. And these are sold by private companies and have their own monthly premium on top of that Part B. So this gives you an example of the different Medigap plans that are available. Don't get confused. A and B do not refer to Medicare Parts A and B. Each letter plan provides a specific set of coverage. So you can see, right now, the most comprehensive coverage you can get would be a Plan C and G, and I'll explain why that is. Plan F is not available to people who are newer to Medicare. So the other thing with Medigap plans to just be aware of is that you need to be careful about if you are a person that has a pre-existing condition. Say you've had original Medicare A and B, you've got your red, white, and blue card, and you never got any kind of a supplemental coverage. And then later on, you decide to add a Medigap plan. You can do that. However, there could be a period of up to 6 months where if you haven't had other creditable coverage, that there would be a waiting period before that Medigap kicks in. So it's a good idea to check with the insurance company on that before finalizing a plan. As I said, these go hand in hand with original Medicare cards. So you can use it with any provider in the United States who accepts Medicare. If you move to a different state, your plan goes with you. One thing to note that's great about New York State is you can enroll in a Medigap plan at any time, and that's not true of other places. So you could start out with A and B and then decide to add later. There's not a specific enrollment period for that. As I mentioned earlier, plans C and F are only available if you were eligible for Medicare before 2020. So I misspoke earlier about Plan C. So I'm going to give some examples that, again, these are premiums are in addition to Part B premium, so it can get a little bit pricey. Um, and you can see the range of costs. So this is what I was talking about. So Medigap Plan A, which is the least amount of coverage, the range of premiums from different insurance companies ranges from $192 a month to $286. Level G, which is the most comprehensive that you can get now if you're newer to Medicare, you can see that huge difference in cost. So it's really a good idea to pay attention to the different costs and companies. And we have all of that information here at Lifelong. Pays to shop around. I talked earlier about if you go this route that you would have a third card. This is not required, just like a Medigap is not required. However, if you don't get a prescription drug plan and when you're first eligible and you add this later, then you could be stuck with a late enrollment penalty. And those typically would last as long as you have Medicare drug coverage. So um, that's we calculate those late enrollment penalties. Some people still take their chances with that, but the risk is that even if you're someone who doesn't take any prescription medications regularly, if you don't sign up for prescription drug coverage initially, and then you find later on that you're on a very expensive medication, that can get really pricey. So this gives you an idea. In 2026, you can get a plan for as cheap as $35 a month for a prescription drug plan that just gives you that peace of mind. Even if you're not someone who needs prescription drugs, you can get the least expensive plan to have it as a backup, and then you would avoid any late enrollment penalty. Um, Similar to Part B, as I mentioned, there's a standard premium, but if your annual income is higher, then you can expect an increase in what the monthly premium would be for Part D as well. The other thing that I'll say about choosing this, if you are someone who takes prescription medications, there is a plan finder program that's on Medicare.gov that helps. You can just type in what medications you're taking, and it will kind of spit out what's going to be the best coverage at the least cost for you. And that's also something that we do here. So just a summary of that original Medicare. Um, Again, you would have the red, white, and blue Medicare card. You would have a Medigap card, a second card if you are somebody who's purchased supplemental insurance. And then you would have a third card if you went with a Part D plan. We have details on all of that here. The other thing is you may have a card from your retiree plan that will work with Medicare. So we'll talk about that a little bit. There's a question here about switching to a different prescription plan later. And yes, there are opportunities to make changes, and I will talk about that. Okay, so now we're on to door number 2. Are there any questions about original Medicare coverage before I jump into this? If there are, throw them in the chat if you would, or you can unmute yourself and ask questions about the original Medicare. Okay, seeing none, I'm going to move on. Door number 2 is the other way that you can get your Medicare coverage, and this is through a Medicare Advantage plan. So these are private companies that provide the same benefits as Part A and B would provide. And many of them, it's kind of a one-stop shopping. You would have one card that would cover both benefits that are offered through original A and B, and it also would typically cover Part D or drug plans. This is part of the Medicare program, and it's regulated by the federal government, but it's private companies. In order to enroll in a Medicare Advantage plan, unfortunately, you don't avoid that Part B premium. So you still have to be enrolled in Parts A and B, but then you can also enroll in a Med Advantage plan. The other thing I wanted to mention, the card that's in here, um, you'll note that this card, I don't know if you can see it, but it shows that the plan is a PPO. That's a preferred provider organization, and that provides in and out of network coverage. So most often you will see these as well as HMOs, which are health maintenance organizations. HMOs only provide in-network coverage. So it's also good to look at the different plan that you might pursue with this. So one of the things with Med Advantage plans is that they use a network of providers and they cover a certain area. So this doesn't typically move with you if you do relocate, like original Medicare. So if you are someone fortunate enough to spend your winters in a different home in a warmer climate, this doesn't mean you can't have a Medicare Advantage plan. It just means that you want to pay attention to what plans are accepted in what areas. Some of them are quite widespread. So you could get a plan here that would still be available in Florida, for example. And you also, with a Med Advantage plan, want to consider who your practitioners are. If you have a primary care doctor and a cardiologist, and any other specialists, you want to check to see that they're in network with the plan that you're selecting. If you have a PPO, you would have in and out of network coverage, but with an HMO, again, you would only have in-network coverage. So if you had an HMO and went to a different physician who's out of network, you would be responsible for paying for that. Like I said earlier, most of these plans include prescription drug coverage, and many include extra benefits like vision or dental coverage. It might give you a couple of cleanings a year, or X amount of money to spend on glasses, this kind of thing. Some of these plans also require a referral if you needed to see a specialist. So you want to just be aware of this kind of thing. So if you look at, these are an example of some of the costs for a Medicare Advantage. Again, these monthly premiums are in addition to what you'd pay for Part B, okay? But you can see that you can get a Medicare Advantage plan that costs nothing extra, a $0 plan. Some of them even will give you a reduction in what you pay for Part B. So often we have individuals who choose this really for the cost if a Medigap might not seem affordable to them, or if they typically tend to not use a lot of medical care. It just depends on your individual circumstance. The other thing to look at with this is with a Medicare Advantage plan, there is a maximum out of pocket. So how this works is that you'll pay a copay. It's very similar to many active employer plans. So maybe you go to the doctor and you have a $10 or $20 copay. If you have a situation where those copays are really adding up, all of a sudden you have a medical crisis, you're using a lot of services, and you're paying a lot in copays, the maximum out of pocket would kick in. And that's usually around $9,000. I'm not sure what the 2026 figure is for that. But if you are in a situation where all of a sudden you're paying a heck of a lot more, then you do know that if you hit that maximum after that point, then your insurance is going to pay for everything. Other questions on Medicare Advantage plans? I'm happy to take them. You can throw them in the group chat. I wanted to mention too that there are Medicare options that some folks are lucky to access as retirees. Some of those retiree plans offer options that function like a Medicare Advantage plan, and some function like a supplemental or a Medigap plan. Some include creditable drug coverage. So it's really important to get any details of a retiree plan from your employer. I will say that, we provide Medicare counseling to anyone, and we have certification of the people who help here, but we are happy to help you learn about what plans are available under Medicare. But you should really have a good idea of what your retiree plan covers before you make a decision. For example, if you decide I'm going to drop my retiree coverage and go to a Medicare option, you likely won't get that retiree plan back. So it's really important that you're well informed on what that retiree coverage is. The other thing is you still have to have parts A and B to access any retiree benefit options. And thank you, Elaine, who's on here. She did say that as far as a Medicare Advantage plan, the maximum out of pocket is typically $9,200. So I didn't have that figure for 2026. So this just gives you a comparison of original Medicare versus Medicare Advantage. I will say some of you signed up to come today and some of you popped in, which is great. If you wanted to get a copy of this PowerPoint, you're welcome to email me after the fact, and I'm going to go ahead and put my email right in the chat. So you're welcome to email me. I'd be happy to send over a copy of this if you'd like to have it to refer to. But this gives you a little bit of an apples to apples comparison. Oops, for some reason I'm not. Oh, there we go. And here's more comparisons. So this kind of gets to the question that was presented earlier about whether you can switch, and you absolutely can. One thing I would say is that don't stress as far as, making the perfect choice. There are different opportunities to make changes. Your choices are not set in stone. Every year, the busiest time for us here in our Medicare program at Lifelong is between October 15th and December 7th each year. That's an open enrollment period that allows people to look at all the choices, any new plans that are coming up, especially if they're in a Medicare Advantage plan, and they can make a change in either their Part D drug coverage at that time or in a Medicare Advantage plan, and that change would be effective in January of the following year. So, for example, if you have a change in your medications and now the plan that you're not on is not good coverage for that medication, that's one time that you can make a change. Another time is that every year from January through March, there is an opportunity for you to switch from one Medicare Advantage plan to another, or from a Medicare Advantage plan to original Medicare. So that's also an option. Your initial enrollment period, if you initially enroll in a Med Advantage plan, you've got a 12-month window to change back to original Medicare within that 12 months of your initial period. And then the other thing is there are maybe, I don't know, 15 different special enrollment periods. So say you move to a different county or a different state and you want to make a change. If you are institutionalized or if you have a family member that's in the hospital, that gives them a special enrollment period while they're there to make those changes. So what I always tell people is if you are unhappy with your coverage, then reach out to us and we'll see if we can help you to make a change or explore some other options. Questions on information up to this point, again, throw them in the chat. If not, I'm going to move on to a couple of savings programs to help on some of these copays, deductibles, and medication costs. Okay. So there are different areas that can help you, assist you in paying for your Medicare. I've listed each here, and I'm going to go into more detail with that. If you are somebody who has Medicaid, and then you are eligible for Medicare. Basically, what happens is that your eligibility for Medicaid may change when you now are eligible for Medicare. So typically what happens is if you're already on Medicaid before you become Medicare eligible, then the Department of Social Services reevaluates you for a different type of Medicaid called ABD Medicaid once you're on Medicare. So that gets reassessed. Medicare Savings Program is an excellent program that looks only at your monthly income, not your assets. And this can help pay for that Part B premium and some other out-of-pocket costs. In order to apply for this, you must be accessing all income that's available to you. So if you have employment income, it calculates, there's a calculation that we can use. It uses like half of your employment income. You also must be collecting Social Security to apply for this. So you have to be receiving all income that's available to you. I don't know if I have Elaine, maybe you can tell me if I have the correct numbers here for Medicare Savings Program, but those are the cutoffs for income eligibility. You might qualify even if your income is slightly higher, as there could be some expenses that are allowable expenses that can be subtracted from that income. So again, if you're anywhere near that monthly income, I usually suggest people come in and have us check it out with you um, because it's a huge benefit. If you are eligible for the Medicare Savings Program, your Part B premium is paid for you, and you could get retroactive reimbursement for those Part B premiums for up to 3 months. Some of the levels of the Medicare Savings Program, if you're particularly lower income, you could have the benefit of providers not being allowed to charge you any deductibles or coinsurance or copays. So it's a really good idea to be evaluated for that if you're anywhere near this.
And yes, Liza, I did update those figures for income
Perfect.
and eligibility for
Okay,
2026.
great, great. Um, the other thing is that if you're eligible for the Medicare Savings Program, you're automatically going to be enrolled in another program, which is called Extra Help, or the Low Income Subsidy. And what that does is helps pay for medications. Extra help, as we looked at this, you might be eligible for extra help, but not for the Medicare Savings Program. So again, this is something we can look at because extra help looks not only at your monthly income, but it also looks at assets. So that's something that we can help screen for if you were to come for get some support here at Lifelong. The other program that's mentioned here is called EPIC. It's a program in New York State that looks only at your income. If your income is below $100,000 a year, then you will be eligible for this. The other thing that's beneficial with the EPIC program is that even if you don't need the savings on your medications, it offers what I call a get out of jail free card or a once a year opportunity to make a change in either your Part D or your Medicare Advantage plan coverage. So that would be outside of those other special enrollment periods. So some people join Epic if it's free for them, just so they have that opportunity to make a change if they need to. So again, the criteria for that program as a New York State resident is for a single person, your income can be up to $75,000 and $100,000 for a married person. I believe that's still the same at this point. So when should you come and see us? If you are somebody who is getting ready for Medicare and you're just looking for some information on your own situation, one of the really great things that Lifelong does is we put out a spreadsheet once all the Medicare Advantage plans have been released for the fall. Um, in Tompkins County, we can do an apples to apples comparison and share that with you. And as we have them, we would provide any updates on how much Medigaps are costing. So that's really a good time as you're getting eligible to come and meet with us or to ask for that information to be shared with you. If you're planning to retire and you might be losing your active employer insurance, it's always good to kind of get a Medicare checkup with Lifelong or any high cap counselor in the area. And then, as I mentioned, there's a fall open enrollment period every fall that gives you an opportunity to make changes. Even if you're pleased with your current coverage, um, especially if you're in a Medicare Advantage plan, it's a really good idea to check out what else is available during that time frame because you may find another plan better meets your needs and is less expensive. We can also, high cap counselors can help with screening you to see if you're eligible for any of those financial programs that I mentioned and to do comparisons. We are an unbiased, we basically sign something saying that we will give unbiased counseling. So this is different from somebody reaching out to you from a particular health insurance company because the only plans that they're going to represent are for their own company. So Lifelong has a number of certified volunteer high cap counselors. We're always looking for new ones if that's something of interest to you, as well as staff members that are certified to provide that counseling. We have to take an exam every year. Um, Throughout the year, we typically offer counseling on Wednesday mornings. We do have other appointments available. And during open enrollment period, our busiest time, we have other days and times available by either by appointment or walk-in clinics. The other thing I'll mention is that the Tompkins County Office for the Aging has 3 staff members who also are certified high cap counselors. But it's really important to see somebody who has gone through that certification so you know that the information you're getting is from someone who's really received all of this training. So I've included here just a little bit more information about high cap program. I had already put in the chat the email for Elaine, who is the Tompkins County high cap coordinator and works here at Lifelong. So she's available to set up appointments as well as the Tompkins County Office for the Aging. A couple of other resources, again, statewide Senior Action Council can help with any Medicare rights situations or fraud circumstances, and the Center for Medicare and Medicaid Services. Whoops. And I have the wrong survey link there. So I'm not sure that I can provide that to you at this point, but certainly, if you have feedback for us, we'd love to hear it. Um, and that's pretty much the bulk of the presentation. I'd be happy to answer any questions that anyone has. You're free to take yourself off of mute. I'm going to show my face here. And are there any additional questions? Hopefully people found this helpful. Thank you, Jane. Good to see you. All right. Well, if there are no additional questions, I hope that this was useful to you. Let's see.
Thanks, Liza. Yes.
Wonderful. Well, I appreciate everybody taking time on this nice afternoon. I know it's not always an exciting topic, but it's really good to get this information out there. and we're happy to help in any way that would be useful to you. So thanks for joining us tonight. Take care, everybody.
Thank you so much.